Chad Asplund, MD, MPH, is a sports medicine physician at Mayo Clinic and a senior associate for the U.S. Council for Athletes Health. Dr. Asplund is a nationally recognized expert in athletic healthcare and most recently served as the past president for the American Medical Society of Sports Medicine. He is currently a team physician for the Minnesota Timberwolves and the Minnesota Lynx and also sits on the NCAA COVID-19 Advisory Committee. Jim Borchers, MD, MPH, is the co-founder and president of the U.S. Council for Athletes Health and the head team physician at Ohio State University. Dr. Borchers holds over 2 decades of experience serving as an athletic healthcare and safety expert. Jim has vast experience with healthcare models at all levels of athletics. The majority of Dr. Borchers' professional experience lies in sports medicine and leadership, serving in a number of important clinical and leadership positions. Dr. Borchers applies his athletic healthcare knowledge as both an author and a public speaker, presenting to athletic organizations on a national scale. And with that, I'll turn it over to our presenters, and we hope that you enjoy the webinar.
Thanks so much, Bob, and want to welcome Dr. Asplund also here today. Appreciate Chad joining us here today. And just want to echo Bob's initial thoughts before we get started today. Here from USCA, or the U.S. Council for Athletes Health. Our mission is really to collaborate with every athletic organization to inspire and ensure athlete health and safety is a priority. And really just want to echo Bob's thoughts again to all the athletic trainers that are joining us here today. Your commitment to athletes during this time, your engagement, your hard work, is really unparalleled through this pandemic in sports. And we just want you to understand that at USCA, we certainly recognize that effort and hope that this webinar today will be something that helps disperse some discussion amongst all of us as we think about moving beyond where we're currently at in winter 2021 into spring sports and beyond. But thank you to all the athletic training staffs throughout the United States, our athletic trainers, our colleagues in healthcare, for doing all you do for healthcare, for athletes, but for healthcare in general, and modeling such great behavior. Today, Dr. Asplund and I are going to spend some time, and again, we'll try to answer some questions if they come up through the Q&A function here of Zoom on 6 different categories of topics that we've organized for you here today. The first category will be some updated information about COVID-19. And we're going to spend some time specifically talking about variants. There's been quite a bit of information put out about variants, some uncertainty about variants. What does it really mean? What does it mean for this COVID-19 pandemic? But what did the variants mean more specifically for athletics and how we would think about conducting athletics in the future? We also want to then move on to talk about COVID-19 and the considerations for spring and summer athletics, as many of us will move back to outdoor sports with a focus on finishing this academic year's athletic season, but also moving into summer athletics and specifically some of the issues around conditioning and preparation for autumn. We want to talk some about vaccination, which has really been a topic that we've been asked a lot about here recently, and specifically vaccination and the impact on athletics. And then we want to just review the CDC update for vaccinated individuals, but also offer some thoughts about how this may impact athletics as we move into the future and how this may be applied to athletic settings. And then we'd like to talk again about autumn 2021 and what athletics outlook looks like as we see it moving forward for the autumn. What we need to be thinking about, how we may need to be addressing COVID-19 at that standpoint, and what we think autumn 2021 may forecast and look like. And then we'd like to finish today by talking about issues that go beyond COVID. One of the things that has happened during COVID appropriately is that we've had a lot of focus there, but there are some really important emerging trends for athletic healthcare and safety that we feel we need to discuss as we pivot some from the pandemic and back to other healthcare and safety issues that are going to become really important for our athletes as we move forward. So with that, I'm gonna start with our first category here, and that updated information about COVID-19, and talk a little bit about with Dr. Asplund about COVID-19 variants. And Chad, I think it would be really nice to start with if you could maybe with the group here talk a little bit about what this COVID-19 variant means, and then maybe how it's spread, and then maybe we can move into some of the other questions. But maybe just, Chad, a overview from you on your thoughts about COVID-19 variants.
Absolutely, Jim. And so the coronavirus is a virus, and as viruses exist and as they evolve over time, they're always looking for ways to survive. And so they mutate, and these mutations are what leads to these variants. Currently, there's 3 or 4, depending on how you look at it, variants that are out there. There's the UK variant that we're seeing a lot prevalent here in America. There's the Brazil variant that I know we just got a couple of cases in Minnesota, the South African variant, and then with pretty high-end genetic studies, they now have identified a New York City variant of viruses that are a little bit more transmissible than the original COVID virus. Again, these viruses mutate to adapt and to survive. And so one of the things you can look at with these variants is that they are more transmissible or more infectious, meaning they're more easily spread from one person to the other. Same rules for COVID variant spread as there is for regular COVID spread. They're airborne, particle spread, and the same real protection in place: masking, social distance, hand washing, don't spend a lot of times indoors with other people. And so the good news on the variant is that although they are more transmissible, meaning they can spread easier, they have not yet shown that they're more harmful or more dangerous so far.
So Chad, I think one of the things that's interesting about variants is, as you mentioned, is we expect viruses to mutate. We expect there to be variations in the virus. I think a lot of people think that when we talk about a variant, that it's really a new virus, that all of a sudden we've encountered something that's different. And even SARS-CoV-2 that causes COVID-19 is still familiar to us from this family of coronaviruses and other viruses that have caused similar type illness. So some people have referred to this as kind of, I'm going to use the term scariant, scaring people that this variant is something totally new that could put us back into, having major issues with this. But how would you classify this variation in the virus, if you had to classify it?